Welcome to the Tiffany Blake Show. On today's edition of Oral Health, we will have Dr. Mark Messier, and he will inform us on some things we can do to improve our oral health. How are you today, Dr. Messier?
Good. Hey, Tiffany.
All right. Well, my first question for you is going to be, what made you become a dentist?
Growing up, I never had a desire to be a dentist. Never even thought twice about it. I did have a desire to get into medicine and help people, and also I've always enjoyed working with my hands. So I was en route to going to med school, going through the application process, but I was also working at a hospital in surgery with a couple surgeons as an assistant, and one of them actually turned me on to the thought of becoming a dentist because he has a brother-in-law that was a dentist, and he asked if I'd ever considered it, and I said, no, not really. He said, you ought to look into it. You might actually enjoy that more than actually practicing medicine as a doctor. So I did, and I actually did enjoy it and liked what I saw, so I kind of changed the gears and went the process of applying to dental school and eventually got in.
And what is something that you see as a dentist that probably could be prevented if individuals would practice better oral care?
The majority of what I see could be prevented from better oral hygiene, better care of the teeth, consistently brushing at least 2 times a day for at least 2 minutes at a time.
Okay.
And I know sounds so simple and so easy, but if people would just floss their teeth once a day, that would make a tremendous difference, because flossing not only cleans in between the teeth where a toothbrush can't reach, but it also cleans underneath the gums where food and debris like to sit, and which leads to gum disease. And I actually pull more teeth due to gum disease than I do to rotten, decayed teeth.
And so when you say gum disease, I just want to elaborate on that for some of our listeners that may, not have a clear understanding.
Sure.
So first off, I'm going to ask you, what is gingivitis?
That's pretty much how gum disease starts, and that is when the infection just affects the gums, which is, when we look at our mouth, the tissue that surrounds the teeth. When the gums become inflamed, swollen, you start leaving food debris. There's actually a little trough around the tooth and in between the gums and the tooth, and if stuff sits in there, that will cause inflammation, which leads to gum disease, which are usually red, irritated looking gums. They bleed easily when you brush or you floss, and oftentimes people think, oh, I'm brushing wrong, or I'm not flossing correctly, but it's actually usually just a symptom of the infection. That's our body's response to bleed when it becomes inflamed.
And so now I'm going to back up to the flossing.
Yes.
Okay, a lot of people stop flossing because their gums are bleeding.
Correct.
So what do you have to say about that?
It's really one of those things. They may be doing it improperly, but the majority of people aren't. If you floss consistently, and assuming you also don't have severe gum disease,
right.
If you're flossing consistently, the bleeding will stop, the infection will go away, the gums will actually tighten, and tight gums are healthy gums, and you won't see the bleeding when you floss or brush your teeth.
What would you say to an individual that really can't see the dentist as much as they should, but they want to practice good oral care at home? What is something that you might suggest to them, like a certain toothpaste, or is there really nothing you can suggest besides the brushing twice a day and flossing consistently?
There are certain toothpastes I can suggest. I would first of all suggest any toothpaste that has an ADA, which is the American Dental Association stamp of approval, which is usually on the box that it comes in or on the back of the toothpaste tube itself. So if you see that stamp, then that usually means it has adequate amounts of fluoride in it, and it's been proven to be efficient as far as a toothpaste. Floss, any floss you can get between your teeth is great. There are different thicknesses of floss, so a lot of people have trouble getting floss in between their teeth. There's actually some that's called, it's made by a company called Glide, and it's like a dental tape, and it's very thin, it's very easy to get in between the teeth. And a lot of people have issues with hand dexterity, like elderly patients, maybe someone with arthritis. They make floss picks, or it's a little instrument with a piece of floss in it, and all you have to do is hold the instrument, and it's much easier to get in between the teeth back there if you can't actually have the dexterity to use your fingers to do it.
And so now I want to ask you about periodontal disease.
Yes.
What is that? And once an individual does have periodontal disease, what options are they looking at?
Okay. Periodontal disease is when gingivitis goes a step further and you actually start to have infection that affects the bone underneath the gums, because what holds our teeth in our mouth is the bone surrounding the teeth. So if the infection goes beyond just affecting the gums, what we see, it will actually cause the bone underneath the gums to dissolve. And when that bone dissolves, teeth get loose and they eventually fall out. Periodontal disease is, again, a very treatable disease, especially if it's caught in its earlier stages. And that's usually something that your dental office can handle at their office. Sometimes there are cases that are severe that require gum surgery, and that's usually performed by a periodontist, which is just a dentist that specializes in gum treatment and gum surgery.
A lot of people will say, well, I only have a few teeth left, so I want to get these few teeth pulled, and then I want to get dentures. So what do you have to say to the public about dentures? When I was in dental school, they would say that it's best to keep as many good teeth that you have as possible, and maybe get like a partial versus getting a full set of dentures. So what do you observe with individuals that have dentures, maybe some problems? So I'll let you elaborate on that.
Sure. Usually, you're right, that is the case. If you have some teeth, it's best to hold on to them, preserve them if you can, and then use them as anchors or attachments for a partial denture. Whereas a full denture, you have no teeth on the top or you have no teeth on the bottom, and there's really not a lot of support for a denture besides gravity on the bottom, and sometimes you can get a little suction on the top denture which holds it in place. But with a partial denture, if it can anchor to a few teeth, that's better than anchoring to no teeth at all. But it's definitely something that will need to be evaluated by a dental professional to see if those teeth are strong enough to support a partial denture, because there are certain times when patients come in with a few remaining teeth and those teeth need to go. They're not strong enough, they don't have the bone support, or they maybe have a lot of restorations in them or a lot of decay. It's just not a wise idea to anchor a prosthesis like a partial denture to those teeth. As far as dentures go, they are necessary for some patients and a good option, and sometimes the only option. But there are a lot of issues with them, or there can be, such as ill-fitting dentures that move or slide around in the mouth when you're trying to eat foods. It can really limit what you try to eat or the foods you enjoy eating. It's not very easy sometimes to bite into an apple with dentures because they're just not strong enough to stay in your mouth, and they may move, so you're looking at cutting up your food that you used to normally bite into, like pizza, have difficulty eating steak, potatoes. It's not a comfortable process for a lot of patients to wear dentures.
We're talking about saving teeth.
Yes.
So what I want to ask you about, some options for saving teeth depending on what state those teeth might be in. You might have an individual come in and maybe just have a little bit of decay. What would you say they could do for that small amount of decay in order to save that tooth, and what should they do moving forward?
If it's a cavity that's not very severe, what I'd call a minor cavity, usually those can be restored with a filling. There are different types of filling materials. There are the amalgam fillings, which are the silver fillings. They used to be kind of the standard of care several decades ago, but the composite fillings, which are the plastic tooth-colored fillings, they've come a long way as far as durability and strength. So there's definitely a lean or push to use those more often as opposed to the silver fillings. So they're great for teeth that have chips or small breaks or small cavities. If you have a tooth that has a lot of decay, then you're usually looking at the option of a crown, which is actually just kind of like a helmet for the tooth. It totally protects the tooth that you see when you open your mouth. That way it looks like a tooth and it still functions like a tooth. You can chew with it, and it's very durable.
And you said crowns, and
Yes.
So for a lot of people, would it be correct for me to say that's what a lot of people call caps?
Yes.
Do you hear people come in and they ask you?
They're very interchangeable.
And I just want to clarify, because a lot of people probably know it as a cap, but the correct terminology would be a crown.
It's either is accepted. I use the term crown more often than cap.
Okay then. Let me ask you this, a root canal. A lot of people say, I'm going to the dentist, I have to get a root canal.
Yes.
So what exactly is that? And the crown follows up after the root canal, is that correct?
A root canal is a dental procedure where we go inside the tooth down into the root where there's a little tunnel, also called a canal, and that's where the nerve is in the tooth, which is also, in the rest of the body, you have individual nerves and blood vessels. Well, inside a tooth, the nerve and the blood vessel are mixed together, and it's actually called the pulp. It's kind of the same consistency as an orange. If you cut an orange open, it's kind of like when you drink orange juice, it gets stuck in your teeth, the pulp.
Yeah.
So that's what the nerve is. We remove the nerve from inside the canal, clean it out, dry it out, and then we seal it up with a material. There are different types of materials we use, but usually the standard is called gutta percha, which is actually just a form of latex rubber. So we fill it from end to end inside the canal. That seals out the blood flow and all the remaining bacteria. And so then the tooth, or what's left of the tooth, the root, can still exist in the mouth. It'd almost be like if you took a turtle and pulled him out of a shell, the shell will still exist. Once that's done, then you're correct, you come back and you cover the tooth, or protect the tooth with a crown to give it strength, because now that you've removed the nerve and the blood vessel, you've removed the nutrients inside the tooth, it becomes more brittle. So you have to strengthen the tooth or protect it with a crown.
And let's talk about an abscess. People will say, I think I have an abscess tooth, but correct me if I'm wrong, there really is no way for you to tell if a person has an abscess by looking. Is that correct? Besides there'll be swelling, they may have some irritation, a lot of pain, but as far as actually knowing, won't you have to get x-rays for that?
You're correct. Yes. Oftentimes a person may have an abscess and not even know it, and it's something we discover just on routine x-rays and exams. But oftentimes abscesses are very painful. The patient will come in with a lot of pain. Sometimes their face may even be swollen, even down into their neck. And that's definitely signs of an abscess, but you still need the x-ray to confirm it, to make sure there's not some other underlying problem that could be going on in their head or neck.
So I just wonder, what would you say to an individual that aspires to become a dentist? What advice would you give them, and what were some of the highlights of your time as a dentist?
I think it's a great profession. I've really enjoyed it. Like I said, for me, it kind of encompasses everything. I like to work with my hands. I've always had an affinity for art, so there's a lot of art involved with teeth, actually creating teeth and making them look natural again, or enhancing someone's teeth to make them look more beautiful. And then of course you also get to help patients and usually get them to leave with a smile on their face, either by getting them out of pain or giving them a look that they've always wanted to have in their mouth. For someone that wants to become a dentist, I would definitely recommend spending as much time as you could in a dental setting, whether it's shadowing or maybe even getting a job in a dental office, just so you can actually see what the day-to-day job entails, because it's more than just sitting down and drilling on a tooth, because connected to that tooth is someone's brain and personality and a lot of other issues, and you also have to work with the staff, and it's a lot that goes into it, but I enjoy most aspects of it.
So I'm going to let you tell everyone, what exactly is a dental assistant and what exactly is a hygienist? I know a lot of people use that interchangeably, but there is a difference to that.
Definitely. A hygienist is someone who has continued their education and gone to a dental hygiene program, and their duties are performing cleanings, professional cleanings of patients' teeth. And that can be from just what we call scaling, which when you go into the dentist, if you have some buildup in between your teeth, they'll remove that. They'll also teach the patient how to brush properly, floss properly. And they're also trained to even remove calculus and tartar that is built up underneath the gums. Like earlier when I was talking about the periodontal treatment for patients that have periodontitis, they're actually trained to do that. They can go beneath the gums with fine little instruments, remove that tartar, which will allow healing to occur back inside the gums, out of periodontal disease. And as far as a dental assistant, their duties involve assisting the dentist with the procedures we perform, such as root canals, fillings, crowns, making dentures, applying orthodontic appliances, whatever the dentist is doing, they're there to assist them.
I know there's a lot of confusion about the process of sterilization. What exactly is a steri center inside of a dental office?
That's the area designated to clean and sterilize the instruments that we use. It involves more than just running them through a machine and getting all the gross debris that's on them. There's also a process of removing that and then packaging them and then running them through a machine that's designed to sterilize, remove all the bacteria from those instruments before they're used again.
Okay. A lot of people usually feel like if they're going to not do something, they can miss a dental appointment or miss, flossing their teeth. But what would you say to individuals about the dangers of not properly caring for your mouth? Because I know that there can be some serious things that follow up behind that if an individual does not care for their mouth properly, such as a heart attack or even some more things that could happen. So I'll let you elaborate on that.
Okay. During our dental exams, where I check I check more than just their teeth. I check their teeth for any possible cracks they may be unaware of. I check for decay that they can't necessarily see that's in between their teeth. That's why we take the x-rays to check for decay in between teeth. But beyond the teeth, I'm also checking their gums, their lips, their cheeks, their tongue. I even check their thyroid gland and salivary glands. They may have an issue where you can actually develop stones inside of your salivary glands, just like you can develop a stone inside your kidney or your gallbladder. And those can lead to problems. They can cause a blockage in that gland, which can be very painful. And I check the thyroid kind of growth, and unfortunately, every year, on multiple occasions, I will find an abnormality on someone's thyroid, and I'll have it checked. Usually it comes back as a benign problem, but sometimes it can be a malignancy, which could lead to cancer treatment. And that's pretty important because sometimes I'm the only person they see that will check their thyroid or their neck and their lymph nodes, because sometimes people will see their dentist more than they see their regular physician. A lot of physicians don't do a head and neck exam, and it may be something that could be easily detected, but it needs to be checked out. So missing those appointments could potentially cause something small to get much bigger and potentially life-threatening, as well as there's an increased occurrence of oral cancer, especially in the younger generation, patients in their 20s and 30s, which you may have read about, HPV being detected in people's mouth.
I tell you what, if you will, hold that thought, and we're going to go to a break.
Okay.
And when we come back from that break, we will what we're talking about and kind of elaborate on what we're saying just now. Tune in with us when we come back to the Tiffany Blake Show on this edition of Oral Health. Encourage love and friendship. Always have a forgiving heart. Love starts with you. A message from Royalties Ad Council. Welcome back to the Tiffany Blake Show on this edition of Oral Health. I am here with Dr. Mark Messier, and he is telling us about some of the things that we can do to improve our oral health. So welcome back. And now we're going to talk about, before we went to break, you were telling us about how HPV can be discovered in the mouth.
Yes.
So we'll just up on that for some of the people that were kind of wondering where we were headed with that.
Sure. The oral cancers, a lot of them that are being detected in the younger generation's mouths and actually the back of their mouth and their throat, is caused by the HPV virus, which there are numerous types of HPV viruses. But the one that's typically detected in the mouth is the same one that's detected in cervical cancer. And there's actually a higher prevalence of it being detected in the mouth than there is cervical cancer. It's definitely something that needs to be checked. Best 6 months or at least every year in patients' mouths during their dental exam.
And I know that a lot of insurances will pay for like the free cleanings twice a year. So you feel like an emphasis does need to be put on that if the individual can possibly make it.
For sure. And that's another, it's called a free cleaning, but actually the patient has already paid for it by paying their monthly or bi-monthly insurance payments. So they definitely should take advantage of that. That's something they've already invested in, and to not go have it done is, to me, wasted money. And it could also be something that could potentially save their life.
For individuals that have had braces, what are some things that you would say that they need to make sure that they stick to doing once they want to keep up their at-home care?
Right. Well, if a patient has braces, they need to have immaculate home care as far as brushing at least twice a day and attempting to floss, or if they can't floss when they have the braces in place, using some type of water irrigator, which goes in and flushes out debris that can be trapped around the wires and the brackets and in between the teeth. And once that's done, they still have to maintain good oral hygiene. If they want to keep the teeth, they've just invested a lot of time and money into straightening. It's actually easier to keep teeth that are straight clean as opposed to teeth that are crooked. And if they don't want their teeth to move after having the braces removed, they have to continue wearing their retainer. And that's not just for a year or two, that's actually for the rest of their life, or as long as they don't want their teeth to move.
And that's something that even I didn't know. So like once you get the braces and you take them off, then you're going to be wearing that retainer for basically a lifetime after that, if you want to keep them in a good shape, basically.
Correct.
So what types of retainers? I know that there's a wire one that you were talking about.
Correct.
So is there like another kind of retainer that somebody
Sure.
may have?
They're clear retainers, which actually look like a clear tray. You may have seen a bleaching tray, or you may have a friend that has a clear retainer that they wear. They need to consistently wear that. They don't have to wear it all day, and they don't necessarily usually have to wear it every day, but they need to be sleeping in it. I'd recommend, if not every day, every other day. And there are also wires that can be placed behind the bottom teeth or the upper teeth to help keep those teeth in alignment as well. And those are what we call permanent retainers. That's not something you take in and out of your mouth. It's something your dentist would take out of your mouth.
And let me ask you about this. I know a lot of college students may not have dental insurance, or even just people in general may not have dental insurance. So what are some options that those individuals might have so that they can maintain their oral care better?
If they can get a dental insurance plan, that's great, because it's definitely a benefit to them. There's definitely a difference though between dental insurance and medical insurance.
Okay.
A lot of people think that when they come in with their dental insurance, if they have a problem, it's all going to be covered. Well, it's only covered yearly to a certain maximum amount of dollars. And for most dental plans, that's about $1,000 maximum. Sometimes you may find a plan that has a $1,500 maximum. So let's say the patient has a tooth that needs a root canal and a crown. Those procedures, the cost of those procedures may total close to $2,000. Well, the insurance company will only pay a maximum of $1,000 or $1,500. So then they're looking at paying the rest of that out of their own pocket. Again, having that $1,000 to use is still a benefit to that patient. So it's good to usually have dental insurance. It's not really necessary, say, for a patient that has dentures, because they're not going to have too many teeth issues.
Let's talk about that. You were talking about dentures. So you say it's important for the individuals to keep healthy gums as well. Say, for instance, the individual has dentures and they think, okay, well, I wear these dentures, you know, I really don't have teeth. But would you say they do need to clean their gums as well? Maybe wipe them with a cloth, or, you know, a soft toothbrush maybe? So what would you say about that?
That's right. It's usually best to clean their dentures after they eat, whether it's just rinsing it out, or they need to clean them at least once a day by brushing with a soft bristled brush, or they also make the tablets that you can put in water and soak them overnight while the patient's sleeping. And that helps clean them. But they definitely need to keep them clean, and they still need to have routine dental exams, because you can still develop issues with the gums, such as cancers or ulcers, or a whole host of problems that can be created from wearing dentures. And so they need to have them checked out at least once a year, if not every 6 months.
So let me ask you about fluoride, because a lot of children are always talking about, you know, they have like this bubble gum flavored fluoride and all these things. So how important is fluoride for a child, or just for people in general?
Fluoride is definitely important. I don't necessarily recommend a patient take oral fluoride drops. They're not very effective. That's something they swallow as an infant or a child, because they're just swallowing it and it's not really protecting the teeth. The way the teeth are protected from fluoride is actually direct contact with the fluoride, such as through drinking water, and they actually put it in a lot of foods and candies now, so that's great too, to have those teeth exposed to the fluoride, because it helps strengthen the enamel where it may be weak, and it also can strengthen the enamel so that it doesn't become weak when it's exposed to sugar, which sugar creates a very acidic environment. This helps protect the teeth from that acid, which can cause decay.
Can too much fluoride be a bad thing? Like anything, it probably could.
It can, and it can actually cause a problem with the teeth called fluoridosis, and that's where you may see for a patient with spots on their teeth, not necessarily black spots, but maybe off-colored like white or tan spots on their teeth. Often that's not a problem of bad home care or anything like that, but while that tooth was developing, it was exposed to too much fluoride and it created those spots in the teeth.
We've talked about, all of this oral care, so now I'm just going to ask you some questions about you. Can you tell everybody where you're from?
I grew up in New Albany, Mississippi. I was born in Tupelo, but all my other days I spent in New Albany until I went off to college. And I went to undergraduate college at Ole Miss. When I graduated there, I went through the application process and worked in, as I said earlier, in a hospital as a surgical assistant for a couple of years. And then I eventually went to dental school at Temple Dental School in Philadelphia, Pennsylvania. And then after graduating there, my family and I moved back to Oxford and currently live in Oxford but work in New Albany.
Do you mind telling us a bit about your family? Married, you have children,
Sure.
or okay, elaborate on that.
I was kind of the odd dental student. I was married when I started dental school and I actually had 2 small children when I started dental school, whereas most of my classmates weren't married, had no children, and by the time I graduated 4 years later, we had 4 children. So I have 1 son and 3 daughters, and they keep us very busy with all their activities and middle school and high school activities that they do.
You talk about you were kind of like a family man in school. So can you kind of talk about time management? Was that something that you learned while you were there, or how was that?
It was very difficult. I definitely didn't have the weekend experiences that my classmates had going to bars and events. I would typically leave my house about 6 a.m. I would have classes from 8 till 4 or 5, leave campus and go to a library and study until we got kicked out, which was usually around 11 or 12 at night. Go home, sleep for a few hours, and do it all over again. So it didn't allow a lot of time. The first 2 years for sure, because it's mainly classroom work. So I missed out on a lot of my kids' developing years when they were very small, which I hate, but it was part of the process to get where I am. So now I'm able to have a career that I enjoy, which does allow me a lot of free time, such as not having to work on Fridays, which is great, and allows me to spend more time with them.
Name of your dental office, I know it's Mercier Dental.
Yes.
And it is located in New Albany, Mississippi, correct?
That's correct.
How did you decide where you wanted to put your office?
After I finished dental school, we decided to move to Oxford. Actually went into a practice with 2 other dentists as an associate, and they have an existing office in Oxford, and they opened the New Albany office that I'm currently located in, and they started that, and I was working for them, and eventually, after a few years, I decided to purchase that practice from them and make it my own. So now it's Mercier Dental.
Okay. The rumor is correct. It was once New Albany Dental.
That's right.
But New Albany Dental and Mercier Dental are the same office, and
yes, it is the same office. Location. We're actually about to move in about a month and a half to a new location. Road just closer to Highway 30.
Okay. So I know that's been a process, but I'm sure y'all are excited.
It's been exciting though. We're all ready for more space and more windows, so we won't feel so much like we're working in a cave all day.
So could you tell us a little bit about your staff? We've talked about some other stuff, but I was just wondering, could you tell us who works at your office with you?
Sure. I currently employ 2 full-time hygienists, and I also have 2 ladies who work our front office who handle our scheduling and appointments, as well as insurance, billing, and claims. And then I also have 2 full-time dental assistants. In our new location, we'll have more rooms to work out of, more operatories. Okay. So with hopeful growth, we may employ more hygienists and maybe more dental assistants, and potentially maybe bring in an associate or a partner at some point.
So you're definitely looking to expand.
Yes.
Sounds good. Do you think that you'll ever open an office, like say maybe in Oxford, where you currently live, or do you think that New Albany is probably going to be?
Well, if
Where
you'd
you
asked me a
gonna
few years ago, I'd probably say no, I wouldn't do that. But I'm learning to never say never to pretty much anything. So it may be a possibility, but currently it's not. But I may change my mind in a month. I don't know.
Has there been an experience that you've had at a dentist, as a dentist, that you feel like just really stuck with you and made a difference?
One in particular, I'm not sure. I have several that I get to experience, fortunately, throughout the year. And those are the moments when we either make a denture or fix someone's front teeth, and you hand them the mirror for the first time to let them see what they have in their mouth, and it brings them to tears. It's a moving situation, and I really enjoy that, seeing someone with that kind of happiness in their mind, and that kind of confidence that creates for them to actually go out and smile again. They may not have smiled in years, or not only just smile, but be able to chew food and eat food that they haven't eaten in years.
So I'm going to ask you about bleaching teeth.
Yes.
I hear a lot of people, say, I got these stains on my teeth, I want to get them changed. So what would you suggest to someone that may have severely stained teeth that are looking to whiten? What would you tell them?
They should definitely discuss it with their dentist, because there are different options, and there's different types of staining. There's what we call intrinsic stain and extrinsic stain. Intrinsic means it may have just been something that developed when the tooth was developing. So it's internal, and it's not really anything that can be altered by just whitening the teeth with whitening strips or whitening solutions that you buy over the counter or get through a dental office. External staining or extrinsic staining is drinking dark colored drinks, tea, coffee, soft drinks, wine. Those types of things can stain the teeth from the outside. And those are things that can be usually corrected by bleaching or whitening. And there's different options there. That you've seen the Crest of White strips they sell in the store. They even make a Crest of White strips that's professional strength that we sell out of our office. We can also make bleaching trays or whitening trays for patients that they wear on their teeth for 30 minutes a day with a whitening solution, and they can get great results from that. And then there's also really strong solutions we can place on a patient's teeth that we can do in office. And that's not necessarily something they can take home, but they can have it done in a dental office.
What are the options for an individual that may have, say, chipped teeth? And they're, they don't like the way their smile look. I've heard of something called veneers.
Yes.
So could you tell the audience what veneers are and why would an individual probably need to get the veneers?
Veneers are typically made out of porcelain, which is like a type of glass, which really mimics or duplicates the look of enamel. Veneer is actually just a covering of the tooth. There are different types of veneers. You may have heard of lumineers, and that's where the patient has a thin shell of porcelain placed over the teeth to disguise or cover up any imperfections in their teeth or misshapen teeth, but they're not for everyone. Also depends on the way the patient's bite comes together, their teeth close together, because veneers are not very durable and strong, like say full coverage crown, which is made out of porcelain as well, but it covers the whole tooth and protects the whole tooth.
Could you tell us if there's any difference in the types of toothpaste to use? I know like some toothpaste will have like peroxide whitening, some will have like a deep cleaning. So could you elaborate when you see all those different things on the toothpaste? Just tell us about it.
Yeah, there are so many options with toothpaste out there. There are the whitening toothpaste, which can help whiten your teeth, but you also have to be careful of what's in those whitening toothpaste, because oftentimes they'll have an abrasive in there, such as a baking soda or some type of ingredient that's kind of gritty, and brushing with that too often can actually damage the enamel on your teeth.
Okay.
So I usually try to tell my patients to try to steer away from the whitening toothpaste, because like I said, it can damage the enamel in their teeth, and it can also lead to tooth sensitivity, which I see a lot in patients. It makes their teeth more sensitive by brushing with the whitening toothpaste or a tartar controlled toothpaste, it has that same type of abrasive in there as well, which can help also damage the teeth.
Once enamel is gone, you cannot replace the enamel or, do anything to bring it back. Is that correct?
That's correct. You start with what God gave you, and if you destroy it, you don't get it back.
So out of this whole conversation that we've had today, what are the top 3 things that you would say that individuals need to take with them to maintain proper oral care?
Definitely brushing at least twice a day for 2 minutes at a time each time. That's very important. And of course, almost equally as important is flossing. Like I said before, I know it seems so simple and ridiculous that a little piece of floss can prevent so many things, but it really can. And I often tell my patients, you only have to floss the teeth you want to keep. So if you don't floss all of them, you're usually not going to keep all of them. And the third thing is have regular visits with a dental professional, just so they can check your teeth, and not just your teeth, all the surrounding tissues in your mouth to help catch a problem when it's small. And that way it's a lot less painful and typically it's a lot less expensive.
Well, it's been a pleasure talking with you, Dr. Messier, and you're my personal dentist, so I know you do a great job, and I look forward to seeing that new office.
Well, good. Glad to take care of you, and thanks for having me on your show.
And thank you for definitely coming. This has been a great edition of the Tiffany Blake Show. Please tune in with us next time, and I look forward to seeing you. Have a great day.